this exercise that I'm going to explain is sometimes referred to as the basic exercise, and it's often used in support of basically training the nervous system to enter into parasympathetic state, or kind of enter into a sense of feeling safe and present, and hopefully a little bit calmer as well. It's a pretty simple exercise, hence the name, the basic exercise. So I hope you find it simple enough. And I kind of invite you to be curious about the sensations that you feel, but also understand that it's the kind of exercise that you might feel something right away, or it might take a few repetitions, a few times over the course of a day, or kind of once a day, for a number of days to really start to feel the effects. Because basically this practice, or this small exercise, is really slowly and gently training the nerves. And nerves are similar to muscles in concept, in the way that the more that we engage them, especially intentionally, and in the way that they're meant to be used, have evolved to be used, the more they'll get more efficient at the job that we're trying to get them to do. So all of that to say is, the more repetition and the more consistent, the more you're going to see results over time. So again, you might not see or feel something right away. If not, don't get discouraged. I encourage you to kind of use this tool as frequently as you can, and hopefully you'll see some benefits over time. So all you need to do, you can do this lying down. I'm going to describe it as though we're sitting up in a nice comfortable position. You can also even do it while standing, but I recommend to start to try it in a nice sitting position, in such a way that your spine can be relatively tall, so not too slouched forward, if that's possible for you. So what you're going to do first is you're actually going to just slowly look over your right shoulder, and I want you to stop as soon as there's any point of resistance. So you're not stretching. The point is not to stretch. The point is simply to see where you have mobility. So just stopping at even a smallest point of resistance, and without judgment, just being curious where that is, noting if there's any sensations there, for example, maybe tension. If there's any pain, please don't lean into it. Just sort of notice, see kind of where your gaze naturally is when you're looking over your shoulder at the point that you stop, and slowly come back to center. And then slowly move over to the left side, the opposite side. It doesn't matter really which side you do, but for our sake, we haven't done the left. So we go looking over to the left shoulder, and same thing, notice as soon as you have a point of resistance, just stop there. Don't push into it. Simply notice where your mobility is on this side. See if it's actually any different from one side to the next. Notice any sensations, and notice sort of where your gaze is able to follow exactly at that point of stopping. Okay, and then you can come back to center. And then now you're going to interlace your fingers and actually bring them up and overhead. So your elbows are going to go out, and you're going to kind of cradle the back of your neck and just the lower part of the back of your head. So right at the nape of the neck, and kind of with your thumbs down. And you don't have to push, but just put some nice gentle pressure so that your head feels quite supported by your hands. Your thumbs are going down your neck, sort of stimulating sensation on your neck. And there is actual reason for this. This is sort of supporting the waking up of the vagus nerve, which meets at the base of the skull here, at the top of the spinal cord. So it's nice to put some pressure there, and kind of with your thumbs. You can even massage a little bit if you want, but that's not the main point. It just feels nice. And then what I want you to do with your elbows out now is you're going to look with just your eyes, so keeping your head straight forward and your torso straight forward. You're going to look just with your eyes towards your right elbow. You may not actually be able to see your elbow, and that's not even the point, so that's okay. The whole point is just that your eyes are completely rotated as much as they can go without any pain over to the right. It can feel a little bit funky, a little bit weird. So just again, to reiterate, elbows are out, hands are behind the back of the head and supporting the back of the neck. Eyes are looking to the right, but the head and the torso stay straight forward. And what I want you to do is stay here in this position for about 30 seconds to a minute and just notice if anything happens. For example, if you yawn or sigh, maybe notice that your breath might for all of a sudden just deepen into your stomach. If you start salivating, this is a common one as well. If none of these things happen, that's also okay, or if you can't tell. Okay, and after 30 seconds to a minute, slowly come with your eyes back to center. Keep your arms where they are and your hands where they are, and then just do the same thing. So looking just with your eyes to the left. So you're going to look to the left, towards the left elbow. It's okay if you can't see it, keeping the head and the torso straight. And same thing, you're just going to stay here, see if something happens. And if not, that's also okay again. And for about 30 seconds to a minute. So just take a little pause here to see if you notice anything. Good, and whatever's happened, come back to the center. You can kind of blink and maybe move your eyes a little bit if you feel a little bit cross-eyed, and your arms can come down. And so now just to close off, you're going to look now slowly again over to your right shoulder and just notice now where you are able to stop. So stop at the point of resistance, any resistance again, and see if anything has changed from the previous time you did it on this side. Notice what your eyes are able to see. Notice if any sensations have changed, thinking about things like tension, pain, flexibility, relaxation, mobility, and then slowly come back to center. And same thing, check now on the left side. Exact same thing. Where's the point of resistance? Has it changed since before, or is it the same? Or can you tell? And if not, that's okay. And any sensations you might be feeling. It's common when we do this check that after doing sort of the basic exercise with the eyes, it's common that people find more mobility in their neck, being able to turn from side to side. There's a lot of physiological reasons for this. What's really cool is it's not actually flexibility in this sense, because again, we haven't been stretching. It shows that it's just a sign to see that the vagus nerve has actually started to activate, which means that our muscles, especially around our shoulders, have allowed us to soften and relax, which means our muscles are actually responding to the nervous system, which is kicking in and telling us where we are in time and space, and that they don't need to hold so tightly or be so activated. So this exercise, we don't have to go deep into the science, but using movement of the eyes, which is a part of the nervous system, which scans our environment to understand where we are in time and place, using our neck rotation, using sort of the stimulation of the hand on the neck and the head, are a few different ways that we are actually waking up the vagus nerve, activating it, and therefore the more we do this, the more we're training it to actually activate and do its job and tell us, hey, we are here, we are okay in this moment, there's no danger around me. So yeah, I hope that you enjoy, and you can do this, lying in bed lying down before bed. You can do it before waking up. You can do it while watching TV. When you feel activated, you can go to the bathroom at work if you're feeling particularly anxious or stressed, or just wanting to do it in general to sort of train that nervous system. You could also do it, if you're on public transit and you don't feel like putting your arms up, you can still look from side to side, with your neck rotation, and you can still use your eyes to look from side to side too, if you don't feel comfortable to have your elbows out. All right, I hope you enjoy.